Thanks everyone for joining us. We're so excited to have a discussion today with Dr. Tobias Brünger and Katie Syverson for our patient passport, which is now launched and in use. And if you don't have one yet, we're going to hear about how to gather one, as well as some of the additional tools as a foundation that we launched in 2024 and some efforts now in 2025. All right. So we'll have some announcements just off the top here, and then hand it over to Katie for some registry updates and chatting through our newest tools. And then, as we mentioned, the passport deep dive, and then some time for questions at the end. Please feel free to pop these in the chat as we keep rolling. So as we mentioned, happy Rare Disease Week. So we've got a lot going on for socials this week. But we really just want to highlight that, we are such a vibrant community and such a big community, but there are so many members that we have yet to reach. Diagnosis throughout rare disease continues to be a challenge, and there are a lot of initiatives for standardized genetic screening underway. And just highlighting this, to really, really consider the impact of what additional awareness in the rare disease community could bring us. So to celebrate this week and to celebrate our 8P heroes, we have an 8 minutes of connection with 8P heroes reading event that'll be going all this week. And so this is a tremendous opportunity to connect with volunteers that are really looking to provide moments of joy and connection for 8P heroes. This will be an opportunity for them to read a storybook to our 8P heroes and provide a moment of engagement. There are still quite a few time slots available where we already have volunteers ready to go, as well as Project 8P team members to join and really provide that opportunity to connect with our folks across the globe. So if you don't have a time slot yet and you would like some time for a dedicated volunteer to read a storybook to your 8P hero, please message us here in the chat or reach out to events@project8p.org. And just a quick shout out to our incredible new intern who has been so instrumental in setting up a lot of the logistics for this event, and of course all the incredible work Katie has done to launch this. So we're really excited about this and grateful it gives us an excuse to continue connecting. A couple of additional pieces that we have are our new 8P Care Needs and Financial Impact Survey. So this one really helps us to understand, the path in 8P, but also we're putting together a welcome packet for new families now. And so being able to document the care that our community encounters and has to fight for helps us to put together that welcome packet. If you have any questions about that welcome packet or any other questions about this, please reach out because we're really excited about this resource and hope to adapt it as a living document that will help families across all distance from diagnosis and time from diagnosis. And then we also have our 8P organ system survey. This is a long one, but this is really important because what we're trying to do is really understand what symptoms are most impactful for our 8P community. And we know that this is going to be variable because each 8P hero is tremendously unique and wonderful. And so understanding what's important to each family is really essential to us. And there's sort of a like an adjunct survey to this that has launched in the Facebook group just to really help us understand how to prioritize symptoms as a foundation, that are going to be most impactful for our community. So thank you in advance to everyone for filling this one out and the one in the Facebook group. And then we also have our MRI and EEG Map the Mind initiative rolling. This is really exciting. So we have a couple of collaborations here that are helping us move this forward to identify signatures of 8P using both brain morphology in the MRI as well as an EEG ideally to be able to predict seizures. So this is really, really exciting. So if you have MRIs or EEGs that you would be able to share, this would be really greatly appreciated. And we hope to be able to share some results from these studies in the coming months. All right. And then also, please do join us for our next roundtable. This will be coming up in about a month. So Allison Long, who's a tremendous speech language pathologist, is preparing some recommendations for 8P, and it'll be a nice opportunity for a dialogue. Any questions? She's quite familiar with a range of assistive communication devices and as well as 8Ps, having treated 8P heroes in the past. So this will be a really wonderful opportunity to dialogue with her. All right, and as I said, please do submit questions as anything that pops to your mind. We're really excited to get to those and to get to the Q&A portion. The Q&A portion won't be part of the formal recording, but the recording will be shared. And we can always follow up with additional questions post call if we run out of time. All right. And with that, I'm so excited to turn it over. Dr. Tobias Brünger has been an incredible postdoctoral fellow for us for months now. He has automated the patient passport in a way that is absolutely incredible and scalable and exactly what we as trying to be on the forefront of knowledge are really looking to implement. And so we're so grateful for his time with us, and we're so grateful for all of the initiatives that he's taken with us. And he'll talk a little bit about this, but we're really thrilled that the work is going to be in a scientific publication that he'll be instrumental in leading. And we're so excited to continue collaborating with him for years to come, and just so grateful for the incredible knowledge that he brings, as well as the incredible dedication to our community. And then, of course, Kaiti Syverson, our patient engagement manager, who is nothing short of like miraculous. We're so grateful that she's here to help us keep, our community strong and really be able to do what we can to really move the needle on our mission. And just incredibly grateful for everything that she does for us. So handing it over to Kaiti, and thank you very much all.
Thank you so much, Lauren. Very sweet of you. I'm so excited, guys. We're going to kind of dive into some registry updates and introduce the passport, which Tobias will dive into a little bit more. So this is our current update. There's currently 223 AP heroes represented in the chromosome AP registry, which, as a reminder, is our natural history study. Of those, we have 95 patients that are confirmed inversion duplication deletion AP, 57 deletion APs, and 20 duplication APs. There's 51 other rearrangements that may be a different form of AP, or they're unknown because we don't have the genetic report to back it up. There is 117 genetic reports. There's 221 caregivers represented, and we have 17 siblings. I'm going to just take you through some of the main surveys. You'll notice here if there's a little star asterisk, that means that that is currently added to this version of the AP Hero Patient Passport. So these are important surveys that we are utilizing in the version that Tobias will be talking about. First up is our birth statistics. We recently updated this, so you'll see there's two versions here. Version 1, we have 107 completions. Version 2 has 41, which we updated at the end of last year. This one is really just looking at birth size, size of birth, NICU stay, reasoning for NICU stay, or any other birth statistics that could be relevant. We have our developmental history, which is really looking at what age AP heroes achieved mobility or communication milestones. And currently we have 118 completions of this one. Our disease and diagnosis history is looking at different behavioral or developmental diagnoses, onset of these symptoms, if there's any regressions, when they became a concern, those type of questions. Again, there's 118 here. And then the child sleep habit questionnaire is really looking at a summary of sleep habits or concerns. And we actually have 71 completions here. So we're finding that this is something we need to dig a little bit more into. Our medication and supplement information survey, this is relatively new. That's a typo. There's 36 completions, sorry. This was new at the end of last year, and we're looking at AP Hero past and present medications or supplements. This includes things like dosing information, brand, age of use, and even an effectiveness ranking from the caregiver. Our AP Care Needs is what Lauren introduced. This is also a new one. We currently have 20 completions, and it's looking at the different therapies, medical appointments, or other interventions that AP Heroes are doing. Our seizure history is another one that we've updated based upon feedback. So the first version had 110 completions, and the second version now has 48. And this one's really looking at seizure history, the types of seizures, onsets, and different medications used. Our organ system involvement is the big one. If there's any survey you take, this is probably the most important. It's really looking at the different symptoms and diagnoses by body system. Our updated version also includes ranking of the most impactful on the quality of life and willingness to participate in clinical trials. We also, one of the things that we added here was whether a diagnosis or symptom is been confirmed or suspected. So we know as caregivers, sometimes we know something's going on, or we have a suspicion that something is going on with our AP Heroes, but maybe we haven't gotten that confirmation. So we definitely want to record everything that our AP Heroes are experiencing. We also collect family and education information, family size, things like that. It also includes information about the birth history of the mother, so the complications she may have had during labor and delivery. Our first version had 107 completions, and we're now at 41. These are just some other surveys that are in there. All right, the good stuff. I really want to walk you guys through this process and thinking about how the chromosome AP registry drives research and impact for care and families. It's going to visually represent the data and knowledge and outcomes that guide our foundation's efforts. So we know at the heart of our foundation are the voices of our families. The registry surveys are more than just data collection. It's a way for our families to be heard, to shape research, and to really drive change. We want it to be empowering for our families to participate in the registry. You'll see that's where it all begins, with our families contributing the crucial information from the registry surveys. As they gain more data, we're expanding our knowledge. And from expanding our knowledge, we are going a little bit deeper now. So we kind of branch off here into two different ways. One is driving our research in clinical care. So the original data that our families contributed expanded our knowledge, which then started to go into driving research and care. This goes into our research studies and our clinical care recommendations. And then this expands to advancing AP care and future treatments. One thing I really want families to recognize here is that it's not just about today. So participating isn't just about today, it's about shaping these future efforts. On the other side of it, what we can do today is develop these care tools, which we're going to dig a little bit deeper into. So the information that we're sharing is letting us know what needs to happen. What do our heroes need, and what can we provide them now? We have our newly launched Patient Navigator and our newly launched Patient Passport. These two care tools also work together. So as we learn more from families and clinicians that are looking at the Patient Passport, it's guiding our Patient Navigator, and we're updating it continuously. Likewise, as we're looking at more symptoms, conditions, recommendations to put into the Navigator, we're adding them back to the Passport. And this is, an immediate benefit that we can see now for the families and clinicians. The one thing I really want to point out here is that this is continuous learning, and we're continuously receiving feedback from everyone. So, and then it circles all the way back up to the registry and starts over again. So this is a continuous loop that we are continuously expanding, improving, and really taking feedback from everyone involved. Okay, so now that we've walked through how the registry fuels research and drives meaningful outcomes, let's focus on the most recent impacts that we've had, which is our patient navigator and our 8P Hero patient passport. I'm going to just briefly touch on the navigator and then let Tobias take over with the passport. Our navigator is easy to use. It's located right on our website. It's based on those surveys, so it's based on our patient-reported symptoms. It's interactive with visualizations and personalized insights, and it's fully accessible. You can also switch it to different languages on the website. We really, created the Navigator to empower families, educators, clinicians, therapists, with giving them up-to-date research-backed guidance for 8P conditions that we're seeing and but care management ideas. It was really a need to fill the gap, providing awareness and equipping families with a resource that they can also share out. One important thing, if you haven't learned yet, is the voices of our community. So we are constantly taking feedback. We actually have created a formalized survey so that families and clinicians can provide us feedback on the Navigator, and we can continue to improve it. So I'll pause for a minute. Everybody can see some of these great testimonials. Great. Here's some more testimonials that we also collected from the first version of the patient passport. We really created this with our families in mind, and their insights continue to shape everything that we do with the passport. It is a way that we wanted to give back to our families who are contributing so much to the registry. So while they're continuously shaping our future and we're completing surveys and, answering those annoying emails from me, reminding them to upload their genetic reports and keep their participation up, this is their way to ensure that their efforts translate into something tangible for them. So we are taking their data, their survey data, and putting it into a personalized passport that really acts as a care tool that they can take back to their providers and give them an overview of their 8P Hero. To dive deeper into the passport, I'm going to go ahead and hand it over to Tobias now.
All right. Thank you very much. I'm really honored to have the opportunity to present and give a little bit of a deep dive into like the 8P Hero passport today. I will start with a little bit, go one step back, basically of all the great things which Katie said, and want to give like more from a research perspective, but also probably also family and clinician perspective. A little bit of background why we believe that it's really crucial to have something like the patient passport, but also like the patient navigator in place. Me personally, I'm working in like a lot of different rare diseases. And this is basically one thing where it becomes very clear that the great challenge of these rare diseases is that there's not like one rare disease, but there are thousands of rare diseases. And they in general affect a lot of or a large fraction of the population. However, individually, they are very rare. And if you then come to a rare disease like chromosome AP disorders, which is really affecting a lot of different parts of the body, which needs a lot of different specialists with really detailed knowledge about the disease, the care is really fragmented, and there's a lot of challenges in like the coordination, the treatment, and in particular being an expert about this disease. So AP disorders need personalized and multidisciplinary care. However, the expert knowledge is typically very limited. And just to highlight a little bit of like the clinical variability of these 8P heroes, which make the overall challenge even larger, I brought like this picture from a couple years ago where it was published, I think like 4 years ago across about 100 AP heroes. And I don't want you to see like any details of this like very colorful map here on the right side, but a sense is that like every small column represents one AP hero. And every row represents a different clinical symptom. And I just want to acknowledge that every colored cell basically indicates an AP hero which has one specific clinical symptom. And if all AP heroes would look the same, basically you would really identify like very clear color patterns. But you can see that these color patterns are scattered all over the place, basically, which means that every AP hero is different and is individual. And in particular, given that AP disorders are so rare, it's very unlikely that one clinician sees like 50 to 100 different AP heroes or patients with chromosome AP disorder. So it's really hard for a clinician to have like even a chance to get an intuition about the disease and the clinical spectrum of the disease. Now, one way, as Katie already mentioned, to capture like this clinical spectrum of the disease are the patient registries. I mean, she gave already like a lot of input, what kind of data is collected. And I just want to highlight here a little bit that these registries and surveys, that they capture critical data from like patients and caregivers, and they're naturally used also like in the past years for natural history studies to identify biomarkers and to get treatment insights. So all this kind of data originally was really often designed to fuel research, improve like treatments, and inform like future studies to improve the diagnosis or the treatment of the disease. However, what was always a little bit missing is that this data, which is provided by the caregivers and the families, that this data has like an immediate impact, not long-term via research, but an immediate impact to clinical care, either for the clinicians or the families and affected patients. So what Katie mentioned is what we try to do with the patient passport, but also with the Navigator, is to bridge the gap to go from registry data to clinical insights. And we outlined as a strategy that there are like a few crucial steps which need to happen. So first of all, you need, of course, to collect the data. I mean, that's always the starting point. But once you have the data collected, what you need to do is you need to clean up the data, integrate and standardize the registry data. Then you need to structure the data somehow and present it in like a clinical and family-friendly way. Because the issue with, in particular, clinicians is that they often do not have the time to spend like a week researching about a disease. So what you need to do is you really need to get like the essential parts summarized that they can take a quick look, have a good overview of the disease, and ideally generate like actionable insights from the data which is provided to them. So the goal is to present the insights of the disease in a patient-centered way. So always centered to this individual AP hero. And this is basically the reason why we developed as a team the AP Hero Passport. So what it is it is a personalized patient-centric tool which basically summarizes the AP Hero's genomic and clinical data and sets it into a context of other AP heroes with a similar genetic disease. And the goal is really to benefit like both patients, caregivers, and of course clinicians who can take a look at the data and probably get an overview of the disease and what to expect potentially. Now it gets nerdy for like just 1 or 2 minutes. I promise it won't be long, but it's like part of like the research presentation also to give a little bit of like methods background of what we did and how the technical part looks like to generate a AP passport. So it all starts basically with this registry data, where you can see here on the left side all these raw files. So it's basically the survey data as you fill them out. Then there are some cleanup and standardization processes, which then in the end enable us to create summaries, create statistics, which we can then feed back into the patient passport. Then, of course, we grab on one hand the data of the individual AP hero for which we generate the passport. And then on the other hand, we summarize the data of AP heroes, for example, which also have an AP deletion if the AP hero for which we generate the passport has an AP deletion. currently we have like some manual quality checks just to ensure that the data we present is also accurate. And then we leverage like an R markdown and in general like R script framework, which basically based on a template, like an overall template that every AP passport looks harmonized, generates a patient-centric passport, which I will then dive in on the next slides and provide some details. So this template generation is based on a LaTeX framework. It's basically a framework which can format all different text pieces and allows us to personalize the text based on patient-specific details. And then we have a lot of visualizations where the goal is just to make the data like really easily accessible to patients in a fast way. And for that, we use like a framework which is called a ggplot, where we have a combination of static pre-generated snapshots dedicated for the different genetic subgroups and visualizations which really reflect the individual symptoms of AP heroes in respective to the genetic subcohorts. Now, to give you an overview of like what the AP passport currently contains. It contains the details of the genetic diagnosis, some family testing recommendations, a general disorder about what AP disorders are. Just for someone who has never been in touch with this disorder, like a clinician who sees the AP hero the first time, they can just skim through this part and get an idea what this disease is about. Then, if the survey is filled out, we provide an overview about the medication and supplements which are currently taken, and if there are any information of medications and supplements which have been taken in the past. You will also find the supplement information with like past medications and probably reasons why you stopped the medication, which, for example, can inform a clinician why or why not to prescribe a certain medication in the future. Then it provides an overview about the prenatal and the birth history with some birth characteristics like weight and height and so on and so forth. The achievement of developmental milestones. So when a patient or when an AP hero is able to walk the first time, speak the first word, and so on and so forth. And then an overview of all kinds of clinical symptoms, which are frequently or moderately frequently present in AP heroes, and which might be present in the AP hero for which the passport is generated. And now in the next slides, I will go a little bit into detail about one of these sections. So we probably do not have time to dive into like every detail of the passport, but I just want to highlight a few sections which I think are really key for this passport. So the first part is really showcasing the genetics of this passport. Here on the right side, you just see a screenshot, but don't worry, I don't expect anyone to read anything from this screenshot. It's just to demonstrate like how it will actually look like in a PDF document. And it will give you some overview about the genetic findings and some details about the deletions and duplications and probably whether the genetic variant was inherited or not. So if we zoom in on this plot, what you observe here is on the bottom where it says like AP hero on the y-axis. This is basically in this individual with like an inverted deletion duplication. We see the size on the chromosome of the AP hero deletion and the AP hero duplication. And as a reference, like what is a typical size or what is the maximum size which we observe in our population of other individuals who filled out the registry survey, we observe like the bars on top, which is basically the range of duplications which have been observed in our whole cohort of AP heroes and the range of AP deletions which have been observed in this community. And as I've notified, there will be also a genetic counselor soon working. Probably the genetic counselor has even started. I'm not entirely sure, honestly, but who will soon join for sure the AP team. And she will definitely also provide more detail into this. And I guess she will be also available to answer any questions with regards to the genetics and the genetic diagnosis of the AP hero. Then the second part is basically, as already mentioned, is providing an overview about the medications as shown here on the right, which really just lists the medication with the frequency and the quantity of the medication taken, and which provides an overview about the genetic testing recommendations, some customizable parts where you can basically outline how, for example, a clinician can connect with my AP hero. So what is a good way to approach your AP hero? Is it like giving high fives or whatever the AP hero likes? You can just outline this in this AP passport, and when you provide this to a clinician, they can prepare and they can adapt the strategies which fits best to the AP hero. And then finally, we provide like a very deep overview about the developmental and health insights, including like the milestones and the presence or absence of certain clinical symptoms which are frequently observed across AP heroes. So for example, when we look at the milestones, when you filled out the survey with these milestones, what you will observe in your AP passport is our graphs like this. So for example, when we focus on the graph here on the right, and the way how to read them is always the same, is this star indicates the age at which it was reported that the AP hero achieved a certain milestone. So for example, when we focus on like this red dotted line, we observe that the AP hero for which we generated this passport, and it's just like a random AP hero data, so it's not like an actual AP hero data which we see here, but it will be in your passport. It will indicate that the AP hero was able to walk at the age of 2.5 years. And now if the question is, how does this compare to other individuals or other AP heroes with the same genetic subgroup? So for example, also with like an AP inverted deletion duplication, we observed that about 50% of individuals at this age were able to walk. So we can basically see that this AP hero achieved the skill of walking basically at the time where like half of other AP heroes with the same genetic disorder were also able to achieve this kind of milestone. And then going to the last, but which is also like very deep part, which is the overview of the clinical symptoms. So the left part is basically part of what Kaiti explained, that AP heroes and their families fill out the questionnaires, we take the questionnaires, and then we do clinical summary statistics. And the way how to read these plots, and you will see many of these plots like on the next slide, is basically when there's a certain symptom, which is outlined always on the x-axis, which could be, for example, intellectual disability, and the bar is colored in gray, it means that the AP hero for which the passport is generated does not have the symptom. So for example, in this case, the AP hero does not have intellectual disability. And we can also see that at the age of this AP hero, typically what we find in 40% of individuals is that this symptom is present, although it is not present in the AP hero for which the passport was generated. On the other hand, when we look at this different symptom, let's just call it symptom Y, we see that this symptom is present in the AP hero. And we also observe that among all the other individuals which we compare this symptom to, we observed that about 50, maybe like 55% of individuals with the AP individual disorder also have this symptom present. So let's put this to like a real life example. When we, for example, take a look at like the physical health symptoms reported in the AP passport. We observed that overall we report on like 9 different symptoms. And in this particular example, we observed that 5 out of these 9 symptoms, so it's a wrong number, what I observed just here, that 5 of these symptoms are also in our example AP hero. So for example, we can tell from this graph that the AP hero has hypotonia, that the AP Hero has motor skill difficulties and scoliosis. However, we also see that although like weakness in general is reported in almost 50% of individuals, weakness is not something which was reported in this AP Hero. Same, for example, with hypertonia. So this kind of plot is meant to give you like a very quick overview about what is present in the AP Hero and what is not present in the AP Hero, and how does this compare to other individuals with a similar AP disorder. To briefly summarize this, the APP Hero Passport is, as mentioned, really like a personalized tool. So it's really meant and based on the survey data for this individual AP Hero, and trying to summarize the genetic, clinical, and genetic and clinical data to basically support patient care and provide in particular an overview about the disease. The goal is to transform all the information which we collected in the registry and make it actionable, not just for research, but actually make it actionable in a way that it can be used as recommendations for family and clinicians, not as a standalone tool, but of course, again, combined with like other tools, for example, like the patient navigator, which was introduced by Kaiti before. And I think like as Laura mentioned earlier, is already that the goal is to publish this whole effort. So, I mean, it's a framework which is basically completely automated, except for the quality control step. Basically, how it works is we just need a name or we just need a patient ID, and then we can run the tool. And 4 minutes later, we have the patient passport for an individual generated. So the goal is to make this framework basically accessible, not only to the AP Hero community, but in the end, it's also an idea that something like this could not only impact AP Heroes, but could be also useful across many other rare diseases. And as we have seen at the very beginning, there are plenty of other rare diseases who could potentially benefit from a framework like this. Now, of course, this is not the end, right? I mean, it's just a starting point. It's basically the very first version which we generated from the AP Passport. So we as a team, and also with some outside feedback, we already have some ideas what could be improved in the next version of the AP Passport. And I will just outline a few of these potential improvements. So for example, currently we present all symptoms at once. However, it's very clear that some symptoms either develop like right at birth, or they will probably never develop at any time point in the AP Hero's life. So it would be good to just stratify these different kind of symptoms, those which are expected to develop early on. And if the AP Hero doesn't have the symptom, then he will probably never develop it, compared to those which typically emerge later in life and where there should be a specific view on something which might develop in the future. Then we will for sure put a little bit more effort and stratify the different genetics, the different genetic subgroups, integrate different breakpoints, and outline the impact of certain affected genes or variants, and also in comparison to other disorders. Put an emphasis on personalized and clinical treatment and guidance about this, together with the patient navigator. And in the end, also provide some guidance about specialty-specific guidance. So as mentioned early on, the care is really fragmented. You need very different specialists. And we could provide like different recommendations in the future through the either passport or other resources provided by the AP organization to really organize the care for the different clinical specialties. And then in the end, I just want to mention this, it really matters to get like feedback from everyone who uses this passport or who listens to the presentation, because like I said, it's just the beginning, and the goal is to move this really forward and improve this tool that it can benefit as many people as possible. And with that, I will pass over to Kaiti again. Thank you.
Thanks, guys. We can open it up for questions now. feel free to just speak out, raise your hand, put it in the chat.